And we do want to talk more about India, where a U.S. travel ban goes into effect today. The country is reeling after weeks of record-breaking COVID-19 cases, with hospitals overwhelmed and a dire shortage of oxygen. NBC News foreign correspondent Molly Hunter joins us from London with more on this. Molly, good morning. So as part of an aid mission, the U.S. is sending $100 million worth of medical aid to India. How much is that going to help?
Hey, Joe, good morning. Look, it's a country of 1.4 billion, as you just heard. Hospitals are completely overwhelmed. This is going to barely make a dent. And we should say, look, it's the U.S., it's Russia, it's 40 other countries. But hospitals there are short of almost everything. So what's happening on the ground, Joe, is that doctors, even for patients that have been lucky enough to get an ICU bed or a hospital bed, the onus is placed on the patients or the family of the patients to then go procure the life-saving drugs or the oxygen. So people are going onto social media, are asking for favors, or running around India, essentially running around all these cities looking for these life-saving drugs. Now, our partners, Sky News, are on the ground in New Delhi. They spoke with the head of an ICU ward there, Dr. Ray. Take a listen, Joe, to what he has to say, what else the international community could do.
If there is any help that we can get from the West or from any other countries, is not just oxygen. It is like any major disaster. What happens in a major disaster, an earthquake? Teams of doctors, nurses, hospital beds come in and they build up a hospital from scratch quickly, like a major. So that is what has to happen.
So they need skilled crisis medics to set up field hospitals. They need oxygen. And Joe, the other thing that experts say, they need therapies to start saving lives right now. Joe?
Molly, here's a number we've been talking about a lot lately. Not even 2% of India's population has been vaccinated, according to estimates. What is stopping a country that makes so much vaccine from actually getting the vaccine into arms?
That's right, Joe. We've been talking about that less than 2% number, and we should say it's about 10% of people in India who've gotten just their first dose. Now, they have opened eligibility up to everyone over 18. Everyone in India over 18 can make an appointment. They are short of supply. They're short of raw materials. They're short of vaccines. Their factories are seeing delays. Now, it's becoming political, Joe, as it often does, and critics are blaming Prime Minister Modi for shipping so many vaccines out of the country earlier this year before addressing the domestic needs. But what's really clear, Joe, is that even if India had all the vaccines in the world today, they couldn't vaccinate themselves out of this current surge because, as we know, immunity takes a few weeks to kick in. Joe?
And Molly, as of today, the U.S. travel ban is now in place. Do we know how long it's expected to last?
We don't, Joe, and we've been hearing from Indian American families and people in India. There are exemptions for U.S. citizens and for permanent residents. But experts do say at this point, this isn't necessarily the best or the most efficient way to control the variant. We know that that Indian variant B.1.617 has already been detected here in the U.K. in multiple U.S. states. The good news, though, Joe, is that very early preliminary data suggests that vaccines are working against that variant. Joe?
All right, Molly, thank you so much.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.